Dr. Vikki Petersen. Today's question comes from a woman who was recently diagnosed with celiac disease, and her weight had plummeted quite dramatically down to 80 pounds. And her question was, she's been off gluten for 4 weeks, and she wants to know when her weight will start to increase. It definitely takes some time. I don't know the age of this patient, nor her other symptomatology. But in general, what you have to realize is that the inflammation that gluten causes in the small intestine really prevents absorption from taking place, which is why weight loss is so common with celiac disease. So getting off the gluten and then really improving what you are eating as far as quality is concerned. So fresh fruits and vegetables, organic if at all possible. Dairy products can be a little bit hard on the celiac because of the degradation of those villi, those finger-like projections in the small intestine. The ability to digest and absorb dairy products can sometimes be compromised for a period of time, if not forever. It depends on the patient. But for right now, I would recommend that she not be consuming dairy products. She gets fruits and vegetables, as I mentioned, chicken, fish, very high quality protein, animals that were not fed antibiotics, watching for fish with mercury toxicity, so getting either the farm-raised or the wild. There's farm-raised fish, by the way, now that they're fed very, very well, and you don't have to worry about the mercury, and you don't have to worry about them being fed poorly. So get with your grocer on that to find out if that's available to you. Good fats are very, very important. Fats that you can really absorb. Olive oil, coconut oil, fresh nuts and seeds. And take it slow if the digestive tract is still so irritated that doesn't want to eat too much. Then milder things, chicken, white fish, eggs, light food is important, but lots of little mini meals throughout the day. Probably the digestive tract at this point is not going to sustain a big meal very well. So that foraging throughout the day, multiple meals, is a very good idea. And on the heel of those recommendations, I would like to talk about non-compliance. So what frequently happens with celiacs and those with gluten sensitivity is they do start to feel better. They've been off gluten for a while, and they're very tempted at a birthday party or some holiday event to cheat, and they want to cheat just a little bit. So I want to tell you a little bit about a study that came out in The Lancet in 2001, and it said that those eating gluten one time a month, so just as little as one time a month, increased the relative risk of death by 600%. So this is a huge number, of course, and one time a month is not a lot of cheating. So even that little increased the risk of death 600%. So non-adherence to the diet is really the chief reason for recurring symptoms in the celiac and the gluten-sensitive patients. So it's just not worth it, and I can't state that strongly enough. Some of my patients have digestive complaints that when they cheat, those digestive complaints are right there, and it doesn't take too many episodes of cheating before they decide it's really not worth it to do that. But what about the patient who cheats and 3 days later is depressed, or the patient that cheats and the inflammatory process that occurs is starting to create arthritis or lupus or MS? So in other words, what the cheat creates is a cascade of symptoms that you don't really feel, but down the line is going to affect you. So at this point, with what we know today, cheating just really isn't an option. So find some yummy goodies that do not involve gluten, because it's just not worth it. So I hope that helps, and until next time, to your very good health, this is Dr. Vikki Petersen.